Welcome, everyone, to today's webinar, Cyberthreats and Healthcare, What Hospital Leaders Can Learn from an FBI Cybercrimes Expert, sponsored by Hewlett-Packard Enterprise and Intel. I am Laura Dierda from Becker's Hospital Review. We will begin today's webinar with a presentation, and we will have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your Q&A box you see on your screen. We look forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link that you used to log into today's webinar to access the recording. It is now my pleasure to introduce today's presenter. James M.T. Morrison is Distinguished Technologist, Cybersecurity Office of the North America CTO. James Morrison joined Hewlett-Packard Enterprise in December 2019 from the Federal Bureau of Investigation as a Distinguished Technologist, Cybersecurity in the Office of the North America CTO. He spent 22 years with the FBI as a senior computer scientist focused on cybersecurity. James worked on numerous national security and criminal intrusion investigations and was active as a cybersecurity expert in security vulnerabilities and implementing solutions. He was a regional program manager for the FBI Computer Science Program and adjunct faculty for the FBI and taught multiple classes at Quantico and internationally. He continued to serve as an adjunct professor of digital forensics at Houston Community College. James was a member of the U.S. Air Force for 8 years as a Unix administrator for satellite telemetry and command and control at Falcon AFB, now Shriver AFB, and a computer communications troubleshooter at Clark AB, Republic of the Philippines. At this time, I am pleased to turn over the floor to James to begin today's presentation.
Thank you very much for the introduction. And thank you all for showing up. And what I'm hoping to do is sort of talk to you today kind of about where cybersecurity is from a healthcare standpoint and some ideas of where we can go going forward. You know, I was hired in December with HPE, but one of my focuses has always been to help companies and corporations and enterprises discover the security solutions that help them, thwart the bad guy. I mean, I worked for years, trying to protect companies and individuals, and really the last 3 to 4 years here in the Houston area, I worked a lot with different industries, including, some of the healthcare industries in the Houston Medical Center. And so I had a really good relationship, across portfolios, across, all the verticals. And really my goal today is to let's start having a conversation about security. Let's see where things are right now. And then let's see if we can't do better going forward. So let's see where we are. So Director Ray last year, actually now it's 2019. Yeah, he got up at the RSA conference and he said that today's cyber threat is bigger than any one government agency, and he's absolutely spot on. I work with a lot of people still within the FBI as well as a lot of cybersecurity companies out there in the industry. And we're all fighting the good fight, but cybercrime continues to grow at an exponential rate. And the COVID pandemic really gave a lot of opportunity for these criminal groups to target different industries. And I'll go through some of those statistics and then kind of explain where I think those statistics may be kind of misreported, or at least not as rosy as they might appear. We have to start, every company has to start having better cybersecurity conversations. And this is absolutely critically, true in healthcare as well. And what's good about it is I think a lot of healthcare industries are getting it. And the fact that you're here is a good thing as well, because we have to start, doing better to protect data at the edge. And so that was one thing, from an HPE standpoint, we've always talked about data at the edge. And I actually wrote up a blog about the idea of like battlefield medicine and what healthcare can learn from the idea of battlefield medicine. And I'll kind of explain what I mean by that going forward. But data really at the edge is going to be crucial. The headlines show that in 2020 so far we've seen 28 health system cyber attacks, and the ransomware has been down in the first half. What's interesting about that is that statistic is somewhat based on Are the slides moving? Esther, I see you seeing something. Are the slides moving? It says live. Are we cool on slides?
Hi, James. Let me just double check here with my team, and we'll make sure we have the slides going correctly.
Okay, because I show a live tag on slide 4 right now.
Let's see here.
Everybody's saying they don't see a slide in the live view. Yeah, somebody said they saw the slides good. Vito says he sees the slides good in the questions.
Oh, good. Well, they must be showing up on our end.
Yeah, Dan said that they're moving as well as Valda, so I think we're okay.
Perfect. Thank you so much. Sorry about any confusion there, James.
Well, that's fine. I just want to make sure. Otherwise, I'm talking to an empty talk track. So
Don't want that. Thank you.
Ransomware did slow down in the first half of 2020, and part of that was interesting is that there was an announcement by a number of ransomware groups that they would not attack healthcare industries in the middle of the COVID pandemic. The ransomware groups in particular are kind of an interesting because a lot of them view themselves as Robin Hood type entities that they'll rob from the rich and and give to the poor, and so if it's true, and I think we've seen some success in that, or some of the groups have agreed not to attack, but I think that's only going to last for a very brief period of time. We did see an attack recently against a large university, against their hospital, where the ransomware, it didn't get into their COVID research, but it got into the hospital network. And so we're going to continue to see those attacks start to slowly creep up going forward. The good news about that is that I think we can use this opportunity of the lull to get better about our security and make sure that we are prepared for whatever comes in next, because it's going to happen. The criminals will target healthcare industries again. So let's use it. Let's use this time to be better going forward. So there was also a report from ABC talking about how the vulnerability that hospitals have to cyber attacks could actually harm patients. This was a 2-year study, and what it really said was that there was actually a way to map cyber breaches to patient care, and it was interesting in that I don't know. I think that needs more information going forward, but the criminals understand that if they can get into a healthcare network and deny the doctors access to the patient records, the hospital is more likely to actually pay that ransom in order to get back into service. I actually stood on stage with a guy who was a IT manager for a large healthcare industry, and they got hit with ransomware, and it for about 48 hours they were really unable to handle any hospital or any ER traffic. They were diverting ambulances to other hospitals, and they ended up having to pay the ransom just because they weren't able to get back into active service. So the denial of access to data is going to continue to be the reality. What we're also seeing going forward, and this is a little troubling, is that ransomware is also becoming a data breach. It's becoming reported that way by states. States are requiring, in many cases, that ransomware be reported just as if it was a breach. But also the Maze ransomware, which is a newer variant that came out this year, actually is starting to steal the data prior to encrypting it. So it's going to be a multi-factor attack, as ransomware groups continue to innovate and become better. I want to encourage you, or at least get everybody to understand, that cyber criminal activity is not a kid sitting in the basement anymore. Most cyber criminal activity, as much as 80% of it, is actually organized crime groups operating out of countries that, in some ways, the countries might be protecting them and helping them, with those attack surfaces. And they're coming out of countries like Nigeria and India, Pakistan. We've seen some activity coming out of Mexico, where drug cartels are actually seeing that cybercrime is more lucrative than the drug trade. So this attack surface will continue to innovate and continue to grow, and there's a huge underground economy in cybercrime. The FBI, one of the places we had really started to focus in the last 3 to 4 years was going after the marketplaces, the dark marketplaces, because that's where you can go out and you can buy denial of service attacks. You can buy ransomware on these marketplaces, and so hospitals and the data and access to companies is often sold on these marketplaces. We believe that this started even as far back as Target, when the Target hit in 2013, that the initial attacker that got into the Target network recognized where they were and sold that access to another criminal who then used it to steal the credit card information. So they do communicate a lot out there in the dark marketplaces. What was really interesting, and I blogged a little bit about it, was we saw that attack against a large hospital on the West Coast, and that hospital actually hired someone to negotiate the terms of the ransom. And that negotiator went on to a chat room and was having a conversation with the ransomeers, and the BBC actually got notified by the ransomeers that this conversation was going to take place, and the BBC streamed that conversation. And it ended up where that hospital paid like a $1.16 million to get their data back. But the reputational damage just by having that negotiation live streamed could be immense, right? And we don't know where that's going to sit long term. But these criminals are also looking to embarrass you. That is part of their motif, is to cause you reputational damage, and they'll threaten that. They'll say, hey, you know what, we're gonna expose you to regulators. We've got access to HIPAA data off your network. We're going to actually call regulators, and we've seen cases of that in Europe with GDPR, where GDPR has been notified of an attack by the people that actually perpetrated the attack, and that's just our reality. These people are not nice people, and they're going to do anything they can to get some money out of you. So we've also seen, and this is kind of interesting, and this is over the last couple of weeks, we've actually seen nation-state attacks going after coronavirus research. And these were 2 warnings that were sent out by FBI and DHS, for example, and European healthcare, saying, these nation states will go after research as well and try to steal it. And so the idea of the data that you do, the research that you do, being actually stolen by a foreign group, foreign power, and then they could actually turn around and monetize that. We've seen that especially in some of the attacks from China, where they've stolen intellectual property and then actually turned around and sold that intellectual property as if they had been the group that had done it. This is interesting with vaccine research too, because I call it the $1 billion. It's probably even more than that. I mean, the first company that comes up with, the first group that comes up with a vaccine for COVID-19 is going to make a lot of money. And so nation states, if they could steal that and then give that information to one of their industry partners, or a group that's owned by the government, they would be able to turn that into a monetization. So we have to be aware of intellectual property as well going forward. So cybercrime will continue to rise. In 2019, the number was somewhere around $2 trillion, and this is hard to actually quantify. But cybercrime by next year, by 2021, could be as much as $6 trillion, which is 1/3 the gross national product of the United States. It is incredibly lucrative. And a good example, I would say, is that I could go out on the dark web, I know where to go, and I could buy a email list of 100,000 emails, and then rent ransomware from a ransomware group as long as I pay them 40% of the profit, and then send that ransomware link to those 100,000 email addresses, and of those 100,000, 5,000 will click. Of those 5,000 that clicked, 1,000 of them will pay me $400 to get their data back. So in that simple $100 investment, I've been able to turn that into a $240,000 personal gain by paying $160,000 of that to the ransomeer. So that's just the reality. It's too easy. We have to start changing the dynamic of cybercrime, and we have to start changing the economics of cybercrime. So one of my ideas, one of my thought processes is it's not a zero sum. I think sometimes we get caught up in the idea of, they're going to win, I'm going to lose. It can be a lose-lose. By not paying the ransom, we do actually thwart them in some way, even if it does cause damage to us. So as we go forward, we have to make sure that we're using technology to protect ourselves and innovate. There was actually also a very interesting report from the Wall Street Journal a couple weeks back, and it was really a look at who is being targeted by cybercrime. And one of the things was that most of us view ransomware as high risk. I mean, I think that's fairly straightforward. But cybersecurity programs, it was like 60% of companies have cybersecurity programs. And I think it's very important going forward that we have to start separating security from IT. And I've often said that I was actually on a blog this morning. I said, when a company takes cybersecurity seriously, they have a person whose entire job is security. So as you're looking for where you want to go next and having the idea of where do we keep our data secure, one of the first things is identify somebody that is going to be in charge of your security program. Cyber insurance is a very rapidly growing industry. And it's actually, a lot of insurance agents will say it is the fastest growing part of insurance as we go forward. So how do we use cyber insurance to actually help our preparedness? A lot of insurance companies will actually have lists of incident response companies that they use, or they'll have product lists that they feel actually reduce risk. But we can actually leverage cyber insurance to be better at what we do. Statistically, by having cyber insurance and having an incident response group on retainer, it actually reduces the cost of a cyber breach by as much as $1.5 million. These are places where cyber insurance companies can help us. Executive level cybersecurity training. Executives have to be bought into the idea of cybersecurity. I often say this is a culture. We have to create a security culture from the top down, and do what we say we're going to do. A good example was I was talking to a trucking company here in Houston, and the security officer came up to me and he said, I have a problem. I said, we're implementing two-factor authentication, but my CEO doesn't want to do it. And I said, well, then you've got a huge problem, because if your CEO is not willing to do it, that message will get down to the lowest level, and people will not have confidence that this is actually something that's valuable. So security messaging, safety messaging has to come all the way from the top down. It has to be something, even if we don't agree with it, we've got to somehow trust our security people and do what they say we got to do. So manufacturing, retail, government agencies are all being targeted. Why is that important to healthcare? Because we are all part of supply chains. And so, you feed into government agencies, your data feeds into them. So the question comes back is, do they have the ability to come back into your network and access data? And if the case is yes, let's say they have the ability to access some of your website data or even write data to, some of your databases, I, as a criminal, might target those government agencies and then come back down your supply chain and actually cause you damage. And we've seen a lot of that. Supply chain attacks, both up the supply chain and down the supply chain, continue. What's also interesting about that supply chain is that only 15% of companies notify people in their supply chain when they've been hit. So what that means is, like, let's say you're a mid-sized or large, hospital. You have primary care doctors that feed into your network. If those smaller doctors' offices get hit with ransomware or get hit with an attack, are they going to notify you that they have been breached? And if the statistic is 15%, and that holds true across, the healthcare industry, then that means you would have no idea that they had suffered that breach until that data either becomes public, or we've seen a lot of this where the breach actually expands into your network. So having some sort of service level agreements with some of these downstream partners has to be part of that. So identifying critical assets has to be part of it, right? Where's your data? So when I used to go out and talk to companies that have been hit with ransomware or something, one of the first questions I would have is I'd say, okay, so what data do you have that's critical? And it was kind of interesting that the answer I got usually was like, well, we have patient data. And I'm like, okay, so where is it stored? And sometimes the answer would be, well, it's in the cloud, or it's in our data center. And I'm like, well, so how secure is that data in the data center? Where does the cloud actually store the data? And a lot of times the people didn't have the answers that were necessary. So just because data might be stored in a public cloud or a private cloud or wherever, we don't lose responsibility for maintenance of that data. HIPAA still requires us to manage that data successfully and to make sure that the proper data security is in place. Also, phishing. I mean, we have to test phishing. If I'm talking about it from a criminal standpoint, I don't care what firewall you have. I don't care what security features you have internally. If I can socially engineer and phish your people, this is still the primary attack surface that we're seeing. This is even more of an attack surface now with people working remotely. People at home are less likely to use proper phishing etiquette and actually sort through the mail. Plus, if they're using home email addresses on the same computer that they're using to access corporate data, they have a lot more of this data coming in, and they don't always, sort through it and follow the proper hygiene. So phishing has to be part of our testing. And as our data pushes closer to the edge and as our employees are working more from home, we need to make sure that our security products are able to protect those home users so that they don't, become a pivot point into our corporate networks. So phishing is going to continue to be, the attack. Also through things like BYOD, bringing your own phones into work. A lot of times when people working from home, they're working on their own laptop. How do we leverage security onto a personally owned laptop or a personally owned phone? And so security solutions have to kind of think about that as well, because that's going to be a continuing challenge. I think a lot of companies are really looking at remote work as being more of a permanent fixture, going forward into the next normal, whatever that might be. But if we're doing that, then we got to make sure that whatever security products we're producing or deploying are actually able to protect us against those attack surfaces. So let's say, for example, you have a home user that's VPNing into your corporate network. VPNs are great for protecting the tunnel and the data while it's in transit, but the endpoints are actually the weak spot. So that home computer that's accessing that VPN, if that user has been clicking on links or using that laptop for things like YouTube or social media or whatever else, that machine could be infected with a virus that could then use that VPN tunnel to get into your corporate network. So we have to make sure that we're sniffing that data and analyzing that traffic, and not just trusting it inherently. And the problem, of course, was that with COVID, we had to stay in business. We took whatever business steps we had to stay in business, and in doing that, sometimes security was sort of an afterthought. We said, well, just take this laptop, go home, log in, here's the way you log in, but we didn't really do a whole lot of that security conversation. So as we start stepping back towards, getting our hands around, security, we need to also start figuring out how we're going to manage that remote security. And that's just going to be, going forward. So ransomware, how much downtime, right? So that's a big question we hear, is that how long would I be down if I got hit with ransomware? At the end of 2019, the average was about 16 days. And so how do I figure out what that would cost me? And I've seen a couple formulas for what ransomware would cost. I think the best one is an $8,500 per minute, or per hour. I'm sorry, that's a crazy cost. No, $8,500 per hour of downtime. And so in hospital environments where that's a 24/7 operation, that means that over a day, you're probably looking at, a loss of somewhere, around $200,000. So, every day you're down will continue to draw that. That doesn't even include costs like, having to turn away, ambulances or something like that. So ransomware will have a huge impact, and it's going to have a huge impact not just in the right now, but in the future. So we'll talk a little bit later about Internet of Things and the vulnerability of Internet of Things. But if ransomware, and we've actually seen this already where ransomware is targeting those Internet of Things devices, if I can get ransomware onto, let's say, a Wi-Fi enabled nebulizer, and then actually shut down that nebulizer that's connected to one of your COVID patients in ICU, what impact would that have on you as a business? You know, those are all connected devices into those networks. So we have to start thinking about, you know, how do I protect that? How do I keep it secure? And I know a lot of us are having those thoughts, but let's start moving those thoughts into kind of the next stage. So some of the statistics from ransomware, you know, I talked about there was that $8,500 per hour. But what's also interesting is we're actually seeing ransomware groups ask for more money. So, you know, the average in, you know, the end of 19 was about $190,000 per ransomware attack. But that was, you know, the average over all of 2019 was 84. Well, we've already seen some attacks in 2020 where they've asked for $250,000. So these groups are actually targeting more for a bigger hit. They want to do less attacks, but get more money in those attacks. So you're going to see, I think, that amount of money that they're requesting going up. What was also interesting, and I thought this was kind of an interesting statistic, was I talked about the idea of cyber criminals using crises as an opportunity to make money. And we always said in cybercrime that no crisis goes unpunished. We saw domains start to be increased, you know, in the end of 2019. And so at December 2019, there were 190 domains that referenced coronavirus. And that number increased to 1,300 in January, 3,000 in February, and by March, there were over 12,000 new domains referencing coronavirus. These domains were often then used for phishing attacks to try to, get people who are curious about coronavirus, and maybe they'd click on it and get infected with a virus, or maybe I could, get them to, give me additional information. One good example was Johns Hopkins had a tracking application early on in the coronavirus pandemic, and there were some bogus websites that were out there that had copied that data, and if you clicked on it, it would actually download a malicious tool into your corporate network. So that's going to continue to be part of the issue. Johns Hopkins sort of recognized that other site, and they came up with some ways to try to shut it down, going forward. But in the interim, how much damage does that cause, or how much, how many people are not going to use the Johns Hopkins, site or the app because they're afraid that it might be the wrong one. Ransomware does hit small and medium businesses a lot. A lot of that goes unreported. 71% was the statistic I saw in 2019. Often it's through RDP, Remote Desktop Protocol. So if you're a medium company even, or a large company, and you've got a managed service provider that's remotely logging into your corporate network, is that secure? Is that managed service provider making sure that your data is staying secure? We saw a huge attack back in March with a company called Cognizant, which is a big managed service provider. And that ransomware was actually able to leverage through their network and hit some of their subcontracts. That's just the nature of what we're going to see. All right. So, and backups are always going to be targeted. 77% of backups, 75% is what I list here. Backups will fail when they're needed. So it's crucially important to make sure that when we're using backups, that we're actually making sure those backups are protected. The old military backup rule was a 3-2-1 rule, which said 3 copies of your data, 2 different media, 1 copy off-site. Or that copy could be maintained in a logically separate network. And so there are backup solutions that will actually not maintain a constant connection between the virtual machine and those backups. But we've got to have our backups, and we've got to be able to leverage those backups quickly. So, back in my day of, when I was working with the Air Force, we were pretty happy if we had an uptime of 98%. Well, that's not the world we live in now. Availability has to be 5 nines, 7 nines, or even in some cases, we're asking for 100% availability. So we've got to start looking at our backups, knowing whether or not they're going to work. And one of the ways we know if they're going to work is by testing them, making sure that those backups are tested. So I think this is a good place to kind of talk about the idea of enterprise of the future. What we're doing, and I think every company is looking at, is edge-centric, cloud-enabled, data-driven. So, how are we moving closer to the edge? By 2025, 75% of our data will be actually produced outside of our data centers. and that data is going to be as high as 175 zettabytes of data, worldwide. What's really kind of interesting also about data at the edge is 80% of that data is never used. So as we look at deploying data at the edge, whether it's through IoT sensors, or whether it's through tablets, or whether it's through phones, for example, how do we actually take that data, manipulate that data, and use it better? Because the other issue we have to know is that as our data gets closer to the edge, we have to process that data closer to the edge. The speed of data becomes more and more important. And here's a good example, and it kind of comes from my life, is both of my parents recently tested positive for COVID. And my mom was at home in hospice care, and that's actually why I'm in New Mexico, but she had tested positive, and when we tried to transfer her out of hospice care and into the hospital care, there was a lot of question of how do we, the ambulance shows up and they're like, well, she doesn't have any symptoms. She was having trouble breathing, but she didn't have, a fever. She didn't have, any sort of, her stats were good. All of that was okay. But because hospice had data in their, enclave, and that data had not been moved into the hospital and then also moved into the ambulance, there was a disconnect between that data. And so it actually took a phone call to have that conversation between the hospice and the ambulance and the emergency room that was going to receive her. But it took an hour or something for that decision to be made. And so as our data becomes more critical, closer to the edge, how do we process that data? And that was my idea of battlefield medicine, is as the need for that data, closer to the patient and processing of that data, how do I make sure that a person who is COVID positive doesn't enter into a common area where they might actually infect other people? Years ago, when I was in the Air Force, I was up in Colorado Springs, and I had pink eye, and I was sent to the Air Force or the Army hospital down at Fort Carson. And I checked in. I said, listen, I think I have pink eye. I'm probably contagious. And the desk lady said, well, go sit there. And I went and sat in this waiting room with about 85 other people, including kids. And in my mind, even back then, I was like, well, why aren't we looking at this? Why are we not processing this data closer to the edge? Why are we not saying this person, we may be creating more of a problem as we go forward? And so I think as we look at more edge, and I think this is going to be accelerated going forward, is processing data, collecting data at the edge, and then processing the data at the edge, which means we will have to have servers closer to that edge, but also using cloud. And how do we use cloud for a true IT transformation and IT availability? And then our data drives what we do. If I'm not deriving, data, if I'm not deriving actionable intelligence, then that data may not be being used correctly enough, right? So how do I actually use that data closer to the edge, process it, and actually turn it into a revenue stream, for example? I think a lot of companies are going to start looking at more revenue streams, and products, of things like location data. But from my standpoint, I've always said where data goes, security has to go. We have to start building workflows with security at its core. So it's not just bolting on security over the top, but it's building security in so that every place my data goes, I know it's secure. And this is incredibly important when we talk about patient data and electronic health records. If a primary care doctor pulls a record or wants to access an electronic health record for a patient, I have to know that they aren't going to actually inject some sort of maliciousness into that file that could then be leveraged into my corporate network. And the Internet of Things is an incredible environment. And as we add more and more of these devices and IoT type devices, and healthcare is huge about this, and I think it's very interesting, but we have to also understand that with every IoT device we add to our network, we are adding a possible vulnerability. And we've seen a number of, and I actually saw this from the FBI, where where products had come out of the supply chain pre-infected with a virus inside that IoT device. So, how do we make sure that our supply chain is secure? How do we make sure that our Internet of Things devices are actually not adding more risk into our environment? And so that's going to be a challenge for us going forward as well. And so when we look at IoT hospitals, these are some of the questions. How do we manage temperature monitoring? I mean, this is a big question right now. How do we actually check the temperature of somebody when they enter our building? What if it's not just a patient coming in through our ER doors, but somebody coming in through the main doors to visit one of their relatives? So these are all challenges as we go forward, and patient flow, and protecting people and all of that. So EHR, I think, is going to be a big challenge as we go forward, because data is starting to move to the cloud, and a lot of these local groups are starting to actually provide patient portals. In telemedicine, I mean, how much did telemedicine become more a part of our life with the COVID pandemic? I can remember 3 years ago sitting with a guy talking about telemedicine, and a lot of the healthcare people are like, bah. Well, right now, telemedicine is going to be more reality, and it works. It has more of an effectiveness. So we're also seeing more mobility. How do I help my patients at the edge, with mobile connections, and then big data? How do I connect that data across multiple data sets? So as healthcare industries start putting this data in the cloud, can I interconnect that data? So one example of this is drugs. We get some people that will go hospital to hospital, ER to ER, and try to get drugs out of those ERs. So as we share that data, can we actually use that data to say, hey, you know what, you were just at another hospital, you're not allowed here, and create actual lists of people that might be some of those drug users trying to abuse the system. And so cybersecurity overall requires a more holistic approach. We got to know that data is the currency, loss of function is the weapon, and we have to protect our data, we have to detect the intruders, and we have to recover from that going forward. And this is not going to go away. Cybercrime is not going to be something that's going to just rise and fall. It's going to be a constant industry, and it actually is being run like a corporation out there. So we have to look at innovating and using innovation to protect ourselves and actually mitigate that threat. And so the enterprise kind of security reference architecture that we talk about is, people, process, policy, procedures, all of those are part of it, but also things like physical security. Am I keeping my network physically secure? If you're storing all of this electronic health record, data on a server that has an open door 24/7, is that server really secure? And one of my guys in HPE is an Army Reserve officer. He would say that when he was out in Afghanistan, some of the insurgents would try to come in and steal the servers themselves, and actually take those servers off and then try to steal the data in the luxury of their own cave or whatever. Physical security is still part and parcel of where we are. So one solution I talk about, one idea, and this is something we at HP have been working on, is what about blockchaining? I've been a big proponent of blockchaining and the use of blockchain technology in Medicaid fraud. Where if a patient comes to the hospital doesn't pay for that patient's care until that care has been validated through an insurance company, validated through the people, the person who is in charge of that person's healthcare. Maybe they have a power of attorney. So blockchaining actually slows the process down, but creates ad hoc networks based upon individual care. I mean, we're big proponents of the zero trust model. I'm a strong proponent of, we've got to start looking at how do I create a network that really no one is ever fully trusted. And I think in hospital, and especially in university-run hospitals, where they may have researchers coming in from outside the United States, and sometimes that creates a vulnerability, or even just the insider threat. And I don't want to say anything about outside researchers, but we all have that insider threat. Every company has it. And I had a healthcare company call me here in the Houston area, and they said, we've got this one doctor, and he's stealing our data. And as I did some investigation, they provided me some log data. I saw that there was a doctor storing data out in a cloud service provider in China. Now, usually when they're stealing data, they don't just go directly home. That just seems very obvious. And so in the interview with the actual doctor, it turns out he was getting ready to quit. And what he was doing was he was taking his research data and copying it up into his cloud location prior to actually quitting. Was that actually a security problem? Was it actually a, well, and our reality was we said it's more of a policy issue because you gave him access to that data and he was copying data that he had legitimate access to. So zero trust models can help us close some of those gaps and at the very least give us visibility to, what's going forward. We always talk about data center security. So we have to protect data and we have to protect the platform. So it's about protecting data at rest, in flight, and in use, but also making sure that the data that we have on our network is trustworthy, resilient, and I have visibility, and I have to do it without compromising performance. So the HP Zero Trust model is built out of our hardware and then moves laterally across the network and interconnects through some of the devices that we have. Because we always believe that security is only as strong as the layer below it, and we think that having a security anchored all the way down into our silicon and anchored down into our CPUs and then actually using that fingerprint that we create of every CPU and moving it up through the stack will actually help us create a better security model going forward. So I actually had the pleasure of doing a presentation with a security officer who had actually implemented a zero trust model. So there's a great article here about implementing zero trust models in the hospital environment. I thought that he kind of said it initially was slow and it was kind of scary, but now he feels so much better about where things are. So let's talk generally about securing your network. Number one, have an incident response plan and test it. A lot of companies have an incident response plan, but they've never actually run a tabletop exercise. I encourage you to run a tabletop exercise and recognize the areas that might be weak. Backups, right? Testing backups, making sure that those backups are actually backing up the information that would allow me to restore myself to operation. External security evaluations. I'm a huge proponent of it. Have somebody come in, give you an evaluation. At least then what they see from a 30,000 foot look. Implementing two-factor, multi-factor authentication, encrypting data at rest, training and testing employees, evaluating access, and evaluate email. Email is very untrustworthy. And so I know a lot of companies have gone away from email internal and created actual things like Slack spaces or Microsoft Teams and use those for internal communications versus using email. And that way email is always considered an external and therefore an external threat. Because breach response really is going to be your key. How long is it going to take me to respond to a breach? And then how am I going to contain it? Because the longer it takes me to contain, the more money it's going to cost me. The less time, and so if you can actually reduce the amount of time to contain a breach under 200 days, you actually save somewhere over $1 million. And so time is absolutely money. I also talked about the idea of having an incident response team in place and testing your incident response plans. You have cybersecurity insurance, and a lot of those cyber insurance companies have an incident response team that they want you to work with. Have them on retainer. If they have them on retainer, you can ask them questions before you actually have to go into a full-blown, oh my gosh, we've been hacked. So work with those kind of groups as well. So these are all kind of overall global questions that I like to ask. Digital transformation. Where are you going to go? Where do you want to go? What security concerns do we have built into that, right? How well does your current model work? Does it work? If my data moved closer to the edge, would my security model actually be able to help me stay more secure? So where are we in the cloud? If we're using the cloud, do we want to move more or less? These are all kind of some of the questions. So if these are questions you have, we would love to sit down, kind of talk to you about them. But at the very least, what I want you to do is have the conversation with somebody. Make cybersecurity, make those cybersecurity questions, now. Don't wait for something bad to happen and then decide that's when you're going to start having these conversations. I always have to throw this plug in. My time in the FBI, InfraGard is a free organization that the FBI sponsors. It's meant to protect the 16 critical infrastructures, including healthcare. So, of course, here in the Houston area, we had a very robust InfraGard chapter with a lot of focus around healthcare. And we actually had one special interest group that was all they did was talk about healthcare and the attacks specific to healthcare. If you're not in InfraGard, it is free, INFRAGARD. There are chapters around the entire United States. But what we really want you to do is we need to start sharing information across industry and making sure that we're making informed decisions that are, and knowing what other groups, other healthcare industries are being hit with. So with that, are there any questions? Let me kind of pop down here into the Q&A and see what we got here. Okay, so I got
you, James.
Let's see, I've got, so the backup rule of 3-2-1, yeah. So I can see what you're talking about with the 3 copies of the data. These could not be physical, for example. So 3 could be just 3 copies of in a digital format. So let's see a virtual machine. Let's say you've got 3 copies of a virtual machine. So 2 of them are on your network. What's kind of interesting is you actually, just even by having a colo service, you may actually already have those 2 copies, but you also want to have 1 copy that's maintained in an off-site location, even if it's only once a week. So, so that external copy, so what we did in the military was we would burn 1 copy of our tape and we'd run it over to the data center. Oh, I'm sorry, am I supposed to read the question first? Is that what Nancy's saying? So yeah, so backup rule of 3-2-1, disagree with the approach. In healthcare, it is not 100% viable, 1,000% not viable to have 3 copies of the data. Expensive, not sustainable, given the massive explosion of data and regulatory requirements to keep data for a set amount of years. Yeah, and that's where I'm saying it. So it could even be the core data of for example, your workstation. So what would be the critical data to make sure that those workstations could come back online following an attack, right? And then the healthcare, the data for your like EHR record could be maintained differently. And you're absolutely correct. Healthcare stores a ton of data in a ton of different locations. So even just having colo services actually does take care of two of those factors. So let's see. Was the downtime number $85 per hour of downtime? Yeah, that's the number that's thrown out there, and it's mainly meant to be a rough estimate of it. It's again it's going to be somewhat independent. I mean, every network is different, and every downtime is different. If you're a tier 1, critical care facility, your downtime is going to probably cost a whole lot more than that. Yeah. Okay. I'll start restating the question. Thanks, Mary. So yeah, how do I evaluate what that downtime is? You could even, if you could get them to share that kind of information, would another group that actually got hit with ransomware share some of that information as to what that cost was? But that's a rough estimate. Another estimate is, let me see, I can need to answer some of these, I guess. I'm going to mark that one as answered, and I will mark that one as answered. Is every one of you is going to have a different, kind of a different network. Every network is different. So average cost time is in terms of minutes, 800K per hour is misspoken. Yeah, I think I said 8,500 an hour, I think is the number. So if I spoke that, then yeah, you're right, that was the wrong number. I believe the problem is when data is being shared after the data is unencrypted or received and not in the transmission. Yeah, so you're right. You don't see a ton of data getting lost in the transmission. It's typically at the endpoints. So endpoint security, that's why VPNs are great. They work, but they don't really protect that endpoint from from a hack or from a bad user, stuff like that. So yeah, you're right. I'm interested in the new encryption process where blockchain is being touted as a new initiative to prevent many of the potential cyber attacks. Do you have any thoughts on encryption down to the character level or just the file or folder level? I believe the threat cannot be addressed unless both the sending and receiving party protect their data going forward. I agree. Yeah, and so one thing we've been working on with an HPE was the idea of encrypting workflow. So there's a lot of companies out there that are actually providing products that the encryption is based upon the individual workflow itself. So when you're creating like a record, each record is encrypted individually, and then there's also some bulk level encryption at the file level. So I think you're going to see more of that going forward. I think you're going to see a lot more encryption focusing down lower. Bulk encryption, and what we did in the military course was we did encryption of particular, we would encrypt a particular channel and then also bulk encrypt the entire bulk of channels. So I think you're going to see more and more of that from a data level. Let me see, telehealth. Yeah. We talked about telehealth. I think telehealth is going to have more kind of going forward. Let's see. I think these are not really questions at this point. Yeah, okay, I can't, those aren't really questions on those ones. I'll mark those as answered and move forward. All right, so top of this. Do you have any recommendations on resources available to assist in building incident response plans and tabletop exercises? Yeah, so, you know, frameworks, some of the basic frameworks, there is one out of, SANS has one, which is a cybersecurity company, SANS. They have one there. I think we actually, Nancy, I think we actually did a incident response plan building webinar, what is that, about in April? And so I can get you some more of that information too. I think I've got that presentation on how to build some incident response plans specific to healthcare. But it's definitely something that we think everybody needs to do that. So how might this apply to a large physician office rather than a hospital? So that's a good question, because you're part of that supply chain. And so, you know, large physician hospitals, you know, we need to look at, you know, how do we protect the data in all of its states? So data at the edge. So now you have people, you know, your doctors are walking around with a tablet. They're entering data in, you know, into that tablet. Is that data protected? So let's say I lost the tablet. Let's start at the most basic level. Let's say one of those tablets was lost. Is there any way for that data to be exposed simply from that, you know, from the tablet, from the physical loss of that tablet? So then how is the data transmitted from that tablet into, you know, into the cloud or into the repository? You know, is it Wi-Fi? So my question then becomes even something as basic as, is that Wi-Fi secure? What's the password? And, you know, a lot of times companies will have the password to their internal Wi-Fi put into a place where you can actually see it, you know, publicly. And there's been a number of snafus around that. So then, you know, once that data is put into the repository, into the cloud environment or into the data center, how is that data secured? How is it secured not just, you know, overall, but how do we do access control? How do we make sure that the people that are accessing it are people that actually have the need and the right to access it? So I think, that's why having a security evaluation, I think, is probably the best place to start, even in a large physician office, and, you know, from there. So what extra precautions do you take with data in flight? I think VPNs are a good place to start, you know, using a VPN to protect my data while it's traveling in flight. But also, I even say, you know, especially like patient data, if I'm sending an Excel spreadsheet or a Word document to an end user, to a customer, to a patient, I should put a password on that document prior to inserting it into my VPN. Now, I don't email that password. That password can either be something we previously agreed on, or the password could be something I text to them. So, you know, I talk to companies that do a lot of financial services, and I say, well, you need to, why don't you make sure that you have the same. You're not allowed to change your, you know, routing number and account number without coming in and physically doing it, but you set a preset a password for people. It can be tough, but it depends on the size of the environment. If you're small enough in that environment, you may be able to do that, you know, and from a patient care standpoint, right? So that's one way I would protect that data. Do I see a move to public cloud helping the security for healthcare systems versus on-prem or private cloud? I personally, and I'm a hybrid environment kind of person from a cloud thing. I think there are certain places that public cloud is good, but I think looking at more hybrid and private cloud will help, you know, healthcare especially. This is where, like, you know, for example, we have a thing called GreenLake. GreenLake is about a cloud environment that could be public, could be private. But you manage that data and you can actually see the usage of that data and manage the security. I think one thing we talk a lot about is VDI, virtual desktop solutions. And a lot of healthcare industry is looking at deploying those healthcare, you know, VDI solutions. You know, VDI does provide better security because I manage that cloud and I can manage those virtual machines. So I think cloud presents some different experiences. But it's very important that when you're moving to whatever cloud environment, that you're having the proper security conversation with that cloud provider. A lot of times we'll see it where somebody says, oh my God, we had a breach in the cloud. And the breach actually comes down to it. They almost always say misconfigured server. It's not misconfigured. The server was configured based upon the conversation that you had. So if you're entering into cloud environments, I would strongly encourage you to make sure you have somebody on your side that speaks the right cloud language, and make sure you're getting all the products you need to secure your data. Do cyber criminals target smaller facilities as much as they do larger ones? Absolutely. Smaller ones tend not to have the budget to protect themselves, making themselves more vulnerable, but are also less likely to have money to pay the ransom. 70% of ransomware is hitting small and medium businesses. What's really interesting, I say this from a sociological standpoint, is they don't care that you don't have money. You can actually negotiate the ransom, and they figure if they can get $10,000 out of you, that's okay. They made something off of the attack. So the amount of budget isn't going to be as important, but that's why in smaller businesses, it's going to be very important to make sure that you're leveraging, if you're using a managed service provider or a managed security, MSSP, managed security service provider, make sure that you're using a company that's reputable, maybe one that has some references inside of the healthcare stack. Maybe they're helping other companies, but talk to other healthcare industries and find out who they're using. Because your IT staffs are going to be a lot less, a lot smaller. So it's going to be very important. And we're also even seeing some kind of consortiums coming in place where larger healthcare is helping smaller healthcare groups become more secure. What is the best method for maintaining an accurate medical device inventory and monitoring those devices for threats and vulnerabilities? That's a tough one because we're seeing so many of these new products coming in, and it's hard to maintain that inventory. That's why I think zero trust models are something that might work better as we go forward. A lot of the modern zero trust models, like HPE's ClearPass, will actually look at everything being plugged in. It'll fingerprint every product that's plugged into those networks and actually help you create reports. So I think this is something that's going to become more automated. I did config management years ago for the Air Force, and it's a pain in the to try to do it manually. You're going to have too much shadow IT, and people are going to plug stuff in without telling you. What's also kind of a problem is like when you call a product in for maintenance, the maintenance guy will never tell you the new one that he put in place. It's very common that they just put a new one and don't even tell you that they took the old one off. Let's see, moving target defenses. Can you explain? Yeah, so defense in depth is going to become more and more of our reality. Data can't just be kind of the cloud, or the idea of a castle is really not the best way to describe how we need to secure our data. The onion is really the idea. We need to look at different technologies, deploying it in depth to, so maybe it's going to be a firewall first, then it might be a router, then it may be an intrusion detection system, but we need to look at defense in depth and then really make the security closer to the critical data more robust. So when we're looking at like EHR data, I need to make sure that what's happening there, is going to be very, very secure. And we also have to understand that one of the biggest problems with defenses is going to be people. People, are going to use bad passwords. People are going to, leave themselves logged in. They're going to do a lot of those things. So we have to start, deploying defense in depth, and that's why also external security evaluation might be helpful. Is an organization more vulnerable if they've already paid a ransom? Yeah, that's a good point. We've actually seen this where companies will pay a ransom and then they get put on the list for future attacks. And so if you pay a ransom once, the hacker may say, hey, they paid it once, maybe they'll pay it again. So we've actually seen sort of an increase in likelihood of getting hit a second or a third time based upon prior payment. So we got to be careful, from paying the ransom. And if you do pay the ransom, and it happens, make sure that you've taken positive steps to secure yourself going forward. Don't pay the ransom and then go back to the same day-to-day operation. We've got to make sure that we continue to patch, continue to look at what the vulnerability. I wish I could tell you the number of companies I had gone into that I was talking to them. They were the second and third time they've been hit by ransomware, and I asked them, did you do anything different between the first and the second attack? And they said no. I was like, I just kind of shook my head and looked at them. I said, well, what did you think was going to happen? And they're like, well, we just never got around to it. Security has to be part of what we do every day, all the time. And when something bad happens, let's learn lessons from those attacks, and let's take positive steps to make sure at a very minimum we don't get hit the same way again. So with that, let me wrap up. If you have any other questions going forward, you can email them to me. I'm also on LinkedIn. I do try to blog. Things have been a little whack since you know, the last couple of weeks, but I like to have security conversations. And if you want to have a one-on-one conversation, I am absolutely available for that. Just reach out to me, and we can try to have those, you know, have those talks. But let's be more secure. Let's start having better conversations around security. With that, thank you, and I will turn it back over to our, I think, Mary, you running that? Oh, so you can reach out to me via email. So james.m.morrison@hpe.com, or I am on LinkedIn as James Morrison. You can reach out to me that way as well. And like I said, I just like to have security conversations. That's kind of my jam, I guess, at this point, because I really do believe that we've got to get better in the United States about protecting stuff. So, thank you.
Thank you, James, for that fantastic discussion. That's all the time we have today. I appreciate that fantastic presentation, James, and thank you to Hewlett Packard Enterprise and Intel for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.